Welcome to Progress in San Diego. Ordinary people doing extraordinary things. We're lucky tonight to have chiropractic doctors. We have Dr. Matt LaRosa and Dr. Denise Maxwell with us this evening. And as you know, we try to focus on positive stories and people doing positive things within the San Diego area. So welcome to the show. It's great to have you guys on my show here. Can you tell me a little about the history of chiropractic and how it all came about?
Yeah, well, you know, the actual premise of chiropractic isn't new. In other words, there's been people who would adjust the vertebrae of the spine or adjust the joints of the spine for thousands of years. But the modern version of chiropractic, or actually when it was first coined, was by actually a gentleman by the name of D.D. Palmer. This was, roughly 1895 when he discovered basically how to remove distortions of the spine and improve people's health. I just wanted to read this little definition for you, Walter, from the World Federation of Chiropractic. And their definition of chiropractic is it's a health profession concerned with the diagnosis, the treatment, and the prevention of mechanical disorders of the musculoskeletal system and the effects of these disorders on the functions of the nervous system and the general health. There's an emphasis on manual treatments, including spinal adjustment and other joint and soft tissue manipulation. So in a nutshell, basically it's a natural form of, it's drugless, it's non-surgical, form of treating the spine and improving people's health. Like that, wouldn't you say?
Yeah. D.D. Palmer was the first chiropractor, and he actually removed nerve interference from a patient's back and restored his hearing. And that was the first true chiropractic adjustment over 100 years ago.
That's what I was going to ask. So this is something that first occurred over 100 years ago, where was it recognized as a form of treatment?
Not prior, not as an organized type of treatment. Like I said, I mean, there's signs and indications that, in fact, like in Mexico, there are people that were called bone setters. So they were roughly the same type of treatment, but there wasn't the documentation and the ongoing studies that have been done with chiropractic. And there's a lot of research that's going on in chiropractic schools to prove what we do has long-range effects other than just treating simple neck strains and back problems.
I was very surprised when I went in for my appointment and I got my adjustments done. So there are things that can be done with the skull. In other words, the skull can be reset.
Absolutely.
And then impurities can then be released within your bloodstream that needs to be cleaned out. That was really amazing to me to discover these.
Well, Dr. Maxwell works a lot more with the skull than some of the joints. Obviously, different chiropractors have different techniques and different treatments preferences. Why don't you talk a little bit about what you do with treatments with the skull now?
I know with headaches are probably one of the number one things that we get in our practice, and working with the occipital bone. If you could just show the base of the skull there. Yeah. The occipital bone is the skull bone that comes out at the base of the cervical spine here. And the occiput can be out of alignment as well as the bones. And when the skull bone or the occiput is out of adjustment, you can get really bad pressure headaches in the back of your head, headaches behind the eye, more tension type headaches, and that's pretty easy to fix. But it also puts a lot of pressure on the nerves that come out of the spine and the vertebral arteries. So you're restricting blood flow. You can have migraine headaches just from that subluxation as well. And you can actually work inside the roof of the mouth with people that have TMJ problems, jaw problems, or misalignments from birth. Some people have very traumatic births, like forceps babies or people with very traumatic, and you can actually work in realigning cranial bones.
Wow, there's just so much about this type of medicine that I am totally ignorant about.
Well, you know, recently a medical doctor made this discovery. You know, of course, once the medical doctors discover it, it's a big news. They said that 90% of headaches are cervicogenic, which means they emanate from the neck. Of course, their mode of treatment would be either some type of intramuscular injections or some heavy-duty medications to relax muscles or inflammation. We've been saying it for chiropractic, we've been saying it for 100 years that we help people with headaches because we know when you correct misalignments in the neck, that the muscles are going to relax, you're going to improve the blood flow into the skull. We cure headaches, or I wouldn't say cure, but we allow the body to cure itself by removing problems in the neck, for instance, for headaches.
So your treatments are more natural, right? In other words, people may take a lot of aspirin and other chemicals. What you're saying is that there are methods that can be applied in which people don't have to ingest a lot of medicine, perhaps.
I'm sorry.
If you take a medicine, you're putting a Band-Aid on the problem, you're not finding the cause. And then there are a lot of side effects to aspirin. You usually don't have an aspirin deficiency. You usually have a neck that's out of alignment, or you have some other nutritional component. So we also look at nutrition and water, people drinking enough water and things like that as well.
I just want to read this quick little part that I just ran across this in Health Magazine the other day. In September of 2008, the U.S. Food and Drug Administration issued a report that confirmed the hazards of pharmaceuticals. According to the FDA, there were more than 450,000 adverse event reports filed for life-threatening injuries resulting from prescription medications over a 6-month period in 2008. That's close to 1 million life-threatening injuries resulting from prescription medications. And those are just the ones that were reported. And that's not even including over-the-counter medications, reactions that people can get. So again, we feel that there's other alternatives to improving people's health that is much more natural, it's safer, literally no side effects. Unfortunate part is there's only about 10% of the population that in this country that see chiropractors. The word is just not out there enough. I mean, the patients are, such as yourself, I'm sure you tell your family and friends about chiropractic, but we just don't have the same grassroots the backing that the medical profession has, and that's why we're here, and we appreciate you having us on today for that.
So I'm assuming that the pharmaceutical industry may play a big part. I mean, we're bombarded all day long with take aspirin, take Tylenol, take something for your stomach, take.
Mm-hmm.
Yet, I see very little in terms of encouragement to seek natural treatment. Homeopathic, would that be the correct term to use about homeopathic treatment in terms of chiropractic?
Yeah. You know what? It's getting better. In fact, there are a lot of medical doctors and chiropractors that are opening up clinics these days because medical doctors, they know, they're in practice. They see that they're not really getting the results that they'd like to. They know that there are most of the time some type of a side effect from the drug that you're taking. So they've been working more and more hand in hand with this, and we're hoping that trend continues. But it's a slow process.
Dr. Maxwell, were you going to say something?
Oh, it's just nice when medical doctors and chiropractors can work together because we all have our own parts to the puzzle to help the person, and the main reason is to help the person, the patient, and to get them better and try to do it in a more holistic way. But we may need medical intervention at some time.
Some support, sure.
So it's not a cure-all, but it is something that actually accentuates medical treatment.
Exactly.
Now, tell me something about what kind of education do chiropractors have to get in order to become doctors?
I think you brought some.
Yeah, I brought some information. I just brought a chart with the difference between chiropractic college and medical school. In anatomy, we have 456 hours. Medical school has 215. The same with physiology, we have 243 hours. They have 174. The big one that I saw, the orthopedics, where we can diagnose orthopedic problems, joint problems, knee problems, elbow, joint, and orthopedic. We have 168 hours. Medical doctors have 2 hours.
And where do people go when they have back pain? They go to the medical doctor.
And they have 2 hours. We have 168.
How to treat these type problems.
We have 271 hours of taking x-rays. Medical doctors have 13.
So what are the total hours?
So the total hours for chiropractors are 2,419 hours in chiropractic college, and medical school is 2,047. And they get a lot of their hours in pharmacology, the drugs and the medication. We don't learn about that. We learn about nutrition. We learn about holistic things. And
I have a bachelor's degree.
You have to have a bachelor's degree and then go into school.
Approximately 4 years after college, so it's
about a 7-year program.
So this is totally amazing.
Yeah.
So what you're telling me is that chiropractors are getting a lot more hours or a lot more education in terms of how to treat people.
Absolutely. In certain categories, and of course, again, orthopedics, musculoskeletal type problems, we're just as well versed in diagnosis. So if somebody comes to us and they have a problem and they're not sure whether or not a chiropractic is the answer, we're trained enough to say, you know what, you've got something going on that it doesn't, I'm worried about. I think I'm going to send you out to have this test or that test. So we are qualified and trained to uncover problems that we're not trained to treat. So it's not like we get our licenses by mail. It's quite a extensive training that we get.
And we're primary care physicians in California as well.
Right. Most insurances cover chiropractic care.
And we don't need referrals from medical doctors. And so we're primary care physicians. We can do school physicals. We can go into schools and do scoliosis screenings and do a lot of things. Sports physicals, things like that.
Well, this is really a paradigm shift for me, in terms of learning more about what you do, and I have a much greater appreciation for what you do. So what I'm ascertaining is that there's just a lot of ignorance out here in the public in terms of how to get proper medical treatment for these types of issues.
That's true. There has been a lot of prejudice against chiropractors, and unfortunately it's originated with medical doctors, and I don't know why they would have a problem recommending us, whether it's competition, because it certainly isn't that we're not trained or educated to treat conditions that we treat. So it's unfortunate, but that's the reality of it.
So what kinds of conditions do chiropractors treat? We talked about headaches, and what other kinds of things?
Well, we have people with disc injuries. People have serious back injuries, and if they don't want to have surgery, they can come in for a first opinion. If they have a serious disc injury, we do a technique called spinal decompression. It was a technique that was devised by NASA. When you're in outer space, you don't have any back pain. So it's a traction device, very specialized, computerized, that actually heals the disc. And I've been through the program myself because I herniated a couple discs practicing. And we also do kinesiology. Well, there are different types of chiropractic, so it depends on what type of chiropractic you go to. But we deal with back pain and neck pain and headaches, and sometimes an adjunct to getting adjustments, people will say, my stomach pain's gone. Well, the nerves, do you want to talk about the nerves?
Yeah, we talked about typical type conditions that patients come for. They think of us as back doctors, back pain doctors, and neck pain doctors. And that is true, but Doc would also back me up on this. She's seen many, many patients, and I've seen many patients in the office that would come in for, say, a low back problem. And then during the course of treatment, they'd say, Doc, I've noticed that my indigestion has improved. Is that any better? And I have to say, well, bring them over to the chart, and I do a little anatomy class right there in the room. If you look at this chart here, every nerve that goes that emanates from the spine, and of course we work with the spine, and it houses the spinal cord. But every nerve goes to, or I should say, the nerves go to every organ. In fact, every part of the body is under the direct control and coordination of the nervous system. So if you've got a problem with your spine, it's kind of like, think of like a radio. It's giving a weak signal. You go through a mountain and you're getting static signal from your radio. Well, it's kind of like if you were having a problem with this part of your spine, you're getting staticky signals to this part of your body. So what we do is we improve how this is functioning in your spine. It removes nerve irritation. So we allow that nerve to get a stronger signal, like that, moving the radio dial a little bit, getting a stronger signal come in. So over a period of time, and it took a while for that organ to become diseased because of the poor nerve supply to it. By removing that, over a period of time, that nerve is strong. We hear it all the time. I hear women's problems respond. I've had children with chronic ear infections that went away by getting regular adjustments. So we don't say that we cure or we treat those specific conditions because we're not medical doctors. That would be practicing medicine. We don't do that. But we do tell patients, if you've got a physical problem that's causing a problem here, doesn't it make sense to see a physical doctor, a doctor that treats you physically?
like a neurological roadblock that, nerves
That's a
exit
good way
the
of putting
spine,
it.
so it's like a roadblock to the nervous system.
You just remove that.
Wow, this is really amazing. So you can have trouble with your stomach based upon something happening with your back.
Right.
Exactly.
Wow. I want to come back to this. Did you want to talk anything about
No, I was just showing.
Okay. The nerves. Okay, perfect. I want to come back to this and revisit. This is absolutely fascinating. But I wanted to talk about a few other things. We have about 15 minutes here. So basically, someone comes into your office with a specific problem. Describe a typical visit to your office.
Well, basically, we do a thorough history. We have a couple of pages where patients will fill out their basic general health status. And, of course, we do a thorough chiropractic exam, which includes some medical doctor type exams, orthopedic tests. Then we do a chiropractic exam. Basically, we're looking for what we call the word subluxation. Subluxation is where a bone is dysfunctional, where it's putting pressure on the nerve, and you can see neurological problems. And again, it doesn't have to be pain. You can have other signs that you're having neurologic problems. So again, once we do
weakness in a muscle, or
yep, we check muscles as well, and we kind of check the whole patient out as opposed to just zeroing in. Again, I hate to refer back to medical docs, but that's what they tend to do. They tend to focus in very narrow vision into, doc, it hurts right here. So yes, of course we're going to check right there. But I've had a patient that had back pain that once I adjusted their foot, their back pain went away.
So you do a thorough check of the patient. Now, then what's the next thing to me?
well, we may send them out for x-rays, especially if they've had some trauma, car accidents. People can walk in our office and, I had this happen yesterday. Oh, we just got in a car accident. Well, that's nice to know. Let's go take some x-rays. And we don't have x-ray on our premise. We used to. We don't right now. So we will refer them out, then we'll get them back. If they haven't had a recent trauma, we may, and not feel that there's a contraindication for the adjustment, then we may give them some physical therapy or do some massage or some electrical stimulation or do some physical therapy and then do a chiropractic adjustment.
Right. If we find that indeed that they do have chiropractic problem, we usually initiate treatment the same day. Most adjustments are done by hand. Some use various instruments, but it's a very gentle type sensation. It's not like you may have heard. You hear the popping and the cracking, and yeah, sometimes you'll hear that. It's very gentle. It feels very comfortable. And again, depending on how long the patient's had the problem, a whole host of other factors. Treatments patient can respond in one treatment. It may take a few treatments. Sometimes it can take a few weeks of treatment. Again, depending on the severity of the problem, how long they've had the problem, are they doing things to continue to complicate their condition?
Okay, so we're going to do all these tests and then you may refer people out. What else might happen? You're going to do adjustments. What else might happen during that visit?
We may follow up with instructions for home. Like they may have to ice. A lot of people need to ice after an adjustment, or maybe they need heat to warm up a muscle.
Stretches to do at home.
Stretches to do.
Exercise.
Proper sitting techniques and walking techniques. So you guys sit on a big old fat wall all day long and they wonder why they have back pain.
I feel my wallet now.
Especially the size of your
wallet.
wallet.
Now I feel my wallet now. Why'd you say that?
But that causes your whole pelvis to be tilted. We've had truck drivers that drive cross country with sciatica.
Now I feel like I'm tilted. See, you got to straighten up now.
We're watching.
So there are a lot of things they can do at home, and then we'll schedule a follow-up visit, and we will recheck them on the next visit, and we'll see how they're doing on their home treatment. And I always call my new patients the next day to see how they're doing, especially if they've never been to a chiropractor before.
Not knowing what to expect.
And maybe they'll bring a family member back sometimes on their next visit, so the family member can see what it's all about if they've never been to a chiropractor.
So this doesn't sound so scary like an acupuncturist. I mean, you're not going to get a bunch of needles stuck in you necessarily.
Right. We lay the hands on your spine, and again, we kind of gently guide the bone back to where it needs to be, or to function the way it needs to be.
Now, how long would it take, and how much does it cost? If I came to you my first visit or whatever, how long would I expect that to take? Or
the visit itself, or the
entire first visit?
Mm-hmm.
Probably half an hour to 45 minutes. Subsequent treatment's only really going to take a few minutes that you're in the office. Cost can be anywhere from $90 to $150 for a first visit. What do we charge in the office? $45 for a treatment.
Most insurance, there's a lot of insurances that cover it.
Automobile,
car accidents, workers' comp, all the HMOs. We have a lot of people with insurance. Medicare loves chiropractic. They cover. Our elderly people even have coverage.
It's true.
Wow. Do you find that most insurances cover chiropractic care?
I would say so, yeah.
Okay. And you hear from some people, once you go to the chiropractor, you will have to go forever.
I love this one. How often do you go to the dentist? Once in your life?
You don't have to go.
You don't have to go, but you take care of your teeth. I go every 4 to 6 months, and my kids go for cleaning and checkup. I don't want any problems. Well, your spine, look at what your spine has. It has all these important areas, a little more than your teeth. So, not that you have to move in, and it's not like you have to move in with us, but prevention is good.
It's like going to the gym. You don't have to. You work out. You don't have to continue to work out if you don't care what happens. So it's not like we force anybody to come into the office. I mean, I get adjusted regularly. Dr. Denise gets adjusted. My family. And again, if you want to make, I say chiropractic is only for people that have spines.
That's a good one.
And if you want to keep yourself out of having serious disc problems or serious injuries, if prevention is better than having to fix the problem.
That's true too.
So before the problem becomes.
What was that joke you got me on just a few minutes ago?
Arthur?
Arthur.
Are you
know
Arthur?
Let's see. Now, do I know Arthur? Who is Arthur?
No, we had a run through, Walter.
Arthritis.
Arthritis. Oh, that makes my arm hurt when you say that.
One of the best ways to slow down that process is to keep joints well lubricated, and there's nothing better than a chiropractic adjustment to a spinal joint or an extremity joint to keep those joints lubricated.
Wait a minute now. Lubricate your joints. How do you? I mean, I have this oral can,
We have synovial fluid in our joints, and when we move the joints, they cause lubrication of the joints. If you don't use a joint, it's going to stiffen up. So now you want...
Have you ever heard of use it or lose it, Walter?
Okay.
Well, it's kind of the same thing.
Frozen shoulders are not good if you don't get in there and break it up,
So this is why we need exercise, obviously. This is something
that's exactly a big part of our regime, yes.
So we have this fluid in our joints.
Every joint. Every single joint.
The fingers, the knuckles, everything.
And what we put in our bodies when we're not in the chiropractic office, what we eat and what nutritionally we take has a lot of effect on your joints as well.
And that's why we do treat patients as a whole. Like I was saying before, we don't zero in. Sure, we're going to zero in on the spot that the patient's complaining about, but we talk about nutrition, we talk about exercise,
drinking the water,
we talk about wearing proper shoes, we talk about maybe the chair that they're using in their workstation may not be ergonomically correct. Probably you've heard that word. It's a buzzword in the last 10 years. Again, a chair that is going to support your spine, and you're not looking one way or another all day at the computer. And so we take the patient as a whole with recommendations. And again, we've been studying for 8 years, so we like to pass that information on to our patients so they can do as much as they can do outside the office to improve and feel better and feel their best and look their best.
So we're down to our last couple of minutes here. Briefly, do you have anything you want to share with the public before we come to a close here?
Well, we also go into schools and communities and workplaces, and we can teach the ergonomics that he talked about. I teach nutrition in schools, and so I think it's important to get to our kids because our kids are the ones that I'm most worried about. Their health is very poor. Type 2 diabetes, which never used to hit people into their 40s and 50s and 60s, it's hitting our young kids, and it's really sad. So that's my passion.
So people, I guess I'd like to end it with people that are active, people who've been in a car accident, people that get hurt on the job. Instead of just taking drugs and masking the problem, allowing that problem to actually get worse because now you're numbing it, you're saying, oh, I feel fine. Everybody should get checked if they've been, like I said, in a car accident, they've been sports injuries. It's better to treat them when they first happen. It's like Doc was saying, it's much easier to treat an acute type injury than it is somebody who's had this problem for 10 years, that they were in a car accident years ago, and said, I'm not going to worry about it. And now 10 years later, they're having headaches, and we take an X-ray, and we see
arthritis comes back.
So everybody should get checked. It really is going to add more years to your life and more life to your years.
Well, this has really been educational for me. And if any of you out there viewing want to get in touch with Dr. Rosa, Dr. Maxwell, you can call the number that's going to appear at the end of this broadcast. And for all of our viewers, we're going to be offering a complimentary chiropractic visit. And I encourage you also to join the Community Coalition so you can become part of our movement. That website is www.meetup.com/SD Community Coalition. This broadcast is supported by all volunteers. We have camera people out here that are everyday citizens. We have 9-year-olds on the crew of our television show here. People from all walks of life. So if you want to get involved with our media project, please feel free to do that and to contact me. Here in Progress in San Diego, we try to cover positive stories because we believe that the people in our community are the stories. We don't have to succumb to the mainstream media. We have everyday people here taking control of our own media. And we're very grateful that you came out to educate the public with your outreach programs. I was totally ignorant of that, and also many of the scientific applications that you have. And I hope that you'll come back soon.
We would love to.
Thank you.
Thank you, Walter. We're really proud of the job that you're doing here as well, and we're glad to be part of it.
We're very happy to have you here. Come back and see us again here, Progress in San Diego. Ordinary people doing extraordinary things. This is Walter Davis, and thank you for visiting us, and come to our website and download that complimentary pass for your chiropractic assistance. We thank you very much for being with us.